Hi, welcome back. Go ahead and start talking a little bit about hepatitis. So there's certainly some things you're going to need to know about this topic, especially with certification. The serology becomes pretty important. So hepatitis, inflammation of the liver, and there are multiple causes. However, viral hepatitis is the most, a virus is the most common cause. So out of infections, virus is the most common infection. And out of all of these causes that can cause an inflammation of the liver, hepatitis A, B, C, D, E are the viruses that are most common causes of hepatitis. Somebody can also have hepatitis that is not related to a virus. They could have hepatitis from alcohol and inflammation of the liver, remember. Medications, especially kind of hepatotoxic medications like acetaminophen overdoses, anti-seizure medications, maybe some antibiotics that can be pretty liver toxic, autoimmune disease. So again, multiple reasons. Um, Usually about hepatitis A, C, D, and E are RNA viruses, and hepatitis B is the only DNA virus. And if you kind of are interested in that and you recognize the difference, sometimes it's a little bit helpful to kind of see like how the virus actually is built and how it affects the serology. But that's for another day. So hepatitis can be acute, chronic, or fulminant. Fulminant is basically liver failure, and the only treatment really for that is a liver transplant. Non-viral hepatitis is not contagious. So if it's a hepatitis caused by a non-infectious agent, it's not contagious. Viral hepatitis is contagious, but all types of hepatitis produce a similar illness. So they have very similar symptoms and they manifest similarly regardless of which one of the viruses cause it. So just with symptoms, it's can't really diagnose what kind of a hepatitis it is. There needs to be some lab work and serology. So let's kind of take a look at this chart right here. So there's a lot of useful information in here. And remember, as far as hepatitis, you're going to want to learn it obviously for your exam today, or not today, but this exam, and then you're going to relearn this again for your certification. And mostly the questions on hepatitis have to, regardless of which certifying agency you do, have to do with the different types of hepatitis viruses, so you can kind of obviously do some teaching, and then the serology, which we're going to do in part 2. So let's start with hepatitis A. Etiology and sources, feces. So that's kind of important to know because you can kind of see here A, B, C, D, and E. And hepatitis A is not a blood or body fluids. Okay, it's feces. A and E are feces. And also it is spread by fecal oral route. Generally that includes water, contaminated food, contaminated water, contaminated shellfish. Spreading by an IV route is very, very rare. And also spreading can be enhanced by crowded places, poor sanitation, and the stool is infectious for this person. So route of transmission, fecal oral. Chronic, no. This hepatitis A does not become chronic. Hepatitis B and C will go into chronic, C being the most common one that becomes chronic. So this is just an acute hepatitis. And infection mortality rate basically is low. Most of the time people are not dying from hepatitis A. Prevention. There is a vaccine. There is a hepatitis A vaccine. That's important for you to know. And it's recommended for children aged 1 year, but it's not a routine vaccine. But if there's going to be somebody who is increased, in a child that's in, or an adult, but the child has to be greater than 1 year old, who are at an increased risk for getting hepatitis A, then they would get the vaccine. Person wishing to obtain immunity, somebody who's at an increased risk for infection, like for example, Somebody who's traveling. That's a perfect example. Somebody who's going to be traveling to a country that they may be more prone to picking up hepatitis A. Hepatitis B is the sources is blood and body fluids. That's route of transmission through blood and body fluids through sex, which is responsible for about 50% of the cases of hepatitis B in this country. So hence, that's why children are vaccinated at a young age. Started in about the early 1990s, vaccinating babies for hepatitis, not because they're in this country, they're in a situation where they're going to get hepatitis B, but it's to protect them when they become teenagers or they become sexually active in preventing kind of sexually transmitted hepatitis B. Contamination with blood, IV drug use, needle sticks, perinatal as far as the baby passing through the mom, other things that would go in this category like piercing, tattoos, acupuncture, anybody who shares a razor blade, something like that, that would be able to be flop and switch in body fluids and blood. It can be acute or chronic, so it be acute and then go away, or it can be acute and develop into chronic. So it could be either. It's a major cause of liver failure and cirrhosis, and you can see hepatitis C is the same. This is the most common one to become chronic. So C is acute and chronic, major cause of liver failure and cirrhosis. Right there, B and C. So prevention, a vaccine. You guys have gotten the vaccine, the Hepativax, that's for hepatitis B. That's important to understand that. And you either got it in doses of 3. That was generally how it's been given over the past, decades. 3 vaccines, certain period of time in between 1 to 2 and 2 to 3. And generally this vaccine we think lasts up to maybe about 10 to 20 years, just depends on who the person is. So this is something that you probably had to get when you started working as a healthcare provider. So there's somebody who needs to be vaccinated. The other thing is for prevention is post-exposure prophylaxis with an immune globulin. So if somebody has a needle stick, for example, a nurse gets a needle stick, hopefully they've had the vaccine and they should be fine with that, but they haven't. They're after exposure, they can do some prophylaxis with giving somebody immunoglobulin to prevent the person for getting hepatitis B. About less than half, somewhere maybe between about 15 to 35% of patients with hepatitis B will progress into a chronic, whereas C is much higher. Okay, the next one, hepatitis C, it's bloodborne. Okay, it's passed by blood. The most common route of transmission is IV drug use. And in the US, it has increased significantly. Hepatitis C is kind of the new HIV. It's increased significantly due to the opioid epidemic. Risk of sexual and perinatal is small. It's generally IV users here. This one is that's responsible for sex is the transmission for mostly hepatitis B. Again, same thing, acute, chronic, major cause of liver failure and cirrhosis. And 90% of IV drug users who get hepatitis C will have chronic hepatitis C. They have it forever. There is no vaccine available for hepatitis C, so that's important to know. We have a hepatitis A vaccine, a hepatitis B vaccine, which is the common one that for healthcare providers, and babies get it. And there is no vaccine available. Blood donor screening can be helpful for prevention. Generally, somebody maybe who has had a blood transfusion prior to 1985 would be more at risk because they started screening them about then. Risk behavior modification is huge as far as don't, swap blood with somebody. Don't use IV, don't share needles, basically. Hepatitis D and hepatitis E are a lot less common, and there's just a few things that you need to know about it. Blood and body fluids, as far as the sources, it is uncommon. And here's the main thing you need to know about hepatitis D. Keep this in mind. Now, this is more common in third world countries as well as E, okay, but in our country, causes hepatitis only when somebody has hepatitis B. Okay, so if somebody has hepatitis B, they can be prone to getting hepatitis D. But if they don't have hepatitis B, you can't get hepatitis D. So that's why it's uncommon. And in the route of transmission is mucosal. And yes, it becomes chronic. And prevention, really none, but it can be prevented with a hepatitis B vaccine, risk behavior modification. So don't get hepatitis B, prevent hepatitis B, and that in itself will prevent hepatitis D. Hepatitis E, um, look at the sources. So the only one with feces are A and E. Again, this is rare, not common in our country, but you could still see some certification questions. D is going to be this one for sure if you see anything on D. And I'll tell you the main thing about E. So it's rare. It is fecal oral, so keep that in mind. It's acute only, so the mortality rate is very low, 1 to 2%. But if a pregnant woman gets it, that's when it becomes dangerous. Okay, if they get hepatitis E, the mortality rate is as high as 20% in pregnant women. So there is no vaccine. Just ensure that these people are drinking safe drinking water. So what are some signs and symptoms of hepatitis? Again, like I said, they're similar regardless of the cause, so you can't really diagnose it on symptoms only. Acute hepatitis has 3 phases. We'll talk about these: a prodromal, an icteric, I'm sorry, so this is a pre-icteric, an icteric, and then a recovery phase. Chronic hepatitis is characterized by continued hepatic disease longer than 6 months. Okay, so short-term acute is less than 6 months. Long-term to lifelong is called chronic, and it must be present greater than 6 months. Symptom severity and disease progression varies depending on degree of liver damage, can quickly deteriorate with declining liver integrity. So somebody with chronic liver disease can certainly deteriorate quickly. Again, fulminant hepatitis is uncommon, rapidly progressing form that can quickly lead to liver failure. It always leads to liver failure. Hepatic encephalopathy, and you know that process, and death within 3 weeks. And if somebody has fulminant hepatitis, or end stage would be another terminology for this, end stage liver disease, the only thing that could really save their life, again, like I said, would be a liver transplant. So let's talk about the acute hepatitis 3 phases of symptoms. So the prodromal or pre-icteric period often is asymptomatic. That's a problem, right? So somebody can be somebody can be infected and they're just sharing needles and having unprotected sex and often asymptomatic, or sometimes they just have signs of like a virus, a viral sign. I'm just not feeling well. I just got these general malaise and fatigue and nausea, vomiting, maybe some headache, anorexia, aversion to smoking and alcohol. This right here is just a general symptoms of having a virus. So they can have nothing or just this from exposure to 2 weeks after exposure. Okay. Then they go into the icteric period, and the icteric period is when they become jaundice, which is something that you're familiar with, yellowing of the skin from accumulated bilirubin in the skin. Since the liver can't conjugate the bilirubin, the liver just keeps circulating, the bilirubin keeps circulating and circulating in the blood, and hence we have these symptoms that bilirubin gets in the blood and it starts to seep into the skin, and we get this yellow skin. Weight loss, jaundice, pruritus, with that bilirubin in that skin, it gives them this itchy kind of dry skin. Some right upper quadrant pain. Important to know that your liver is in the right upper quadrant. clay-colored stools and dark urine. I've talked about this before as far as if the bilirubin is not where it's supposed to be, conjugated in the liver and stored in the gallbladder. It's not being shot out the common bile duct into the gut, into the intestine. So it's not in the stool. So your stools are not dark. They're clay. They look like cement. There's no bilirubin in it because the bilirubin's in the skin and in the urine. Obviously, the blood goes to the urine and the bilirubin comes in. So important to understand these symptoms go together: the jaundice, the color schools, dark urine, low-grade fever. Hepatosplenomegaly may be present. Remember, we shouldn't be palpating a liver. If you can palpate a liver that extends beyond the rib cage here, that's hepatomegaly, which could progress and which could cause some swelling in the spleen as well. So this is during weeks 2 to 6, and then there's a recovery period for somebody who has acute hepatitis. Okay, acute hepatitis, and then they recover. They begin with recovery of jaundice, occurs 6 to 8 weeks after exposure, basically. In general, these are general terms. All right, that's it for phase 1, part 1, and in part 2, I'm going to talk about the lab and diagnostics and the serology and the management. Thank you.